Good morning, buenos días. Before we begin, we do have an announcement about how to use simultaneous interpretation. Buenos días, antes de iniciar la sesión, tenemos instrucciones para el uso del servicio de interpretación. Ahora procederé con las instrucciones en inglés y vuelvo con ustedes en español. Once again, we do have interpretation available. To use the feature, please scroll down to the bottom of your Zoom screen where your mute controls are. Click on the interpretation icon. It looks like a little world, and then select English as your language. If you are joining through the Zoom mobile app on a cell phone, tablet, or other mobile device, first press the ellipsis, the three dots, then interpretation, and then choose your language. Finally, click on mute original audio to not hear the original Spanish low in the background. Muy buenos días, se está ofreciendo servicio de interpretación simultánea. Para hacer uso del mismo, por favor desplácese a la parte inferior de la pantalla de Zoom donde aparecen sus controles, haga clic en el icono de interpretación, parece un globo terráqueo, y seleccione Spanish o español. Si está utilizando la aplicación móvil de Zoom, en celular, tableta, etc., presione primero los puntos suspensivos, luego interpretación y luego el idioma. Por último, si no desea escuchar el audio original en inglés en el fondo, por favor seleccione Mute Original Audio o silenciar audio original. Thank you. This concludes the announcement for interpretation instructions.
Welcome. Bienvenido. Before we get started, I want to set a few ground rules. One of our presenters was not able to make it today, so each of our presenters will have about 20 to 25 minutes for their presentations. After both speakers have finished, we will have time for robust conversation. We'll be using the chat function for questions and comments at that time. So to help us out, please identify which presenter you are directing your question towards so we can help facilitate that conversation. Overall, today is a celebration of innovation that has taken place in our trans-border region to confront the public and mental health challenges brought about by COVID. Dr. Hoyt and I are excited to facilitate this public health session today. We represent the San Diego State RISE Center. RISE stands for Research, Innovation, Student Engagement. Over the past 14 years, we have worked to build community-based participatory research, foster innovation, and engage our students in efforts to tackle the challenges facing Imperial County. We are established as a resource hub that is focused on community academic partnerships. Today, the presentations you will experience are prime examples of community and academia partnering to pilot innovative solutions to challenges in our dynamic trans-border region. We will first provide an overview of public health and then transition into the presentations followed by a question and answer session. We will ask that you use your chat for the questions once again and use that chat to provide any links to any resources you find helpful regarding the discussions that occur. We hope that this will be an engaging and inspiring session for each and every one of you. It is helpful to start with some key public health frameworks. And we're going to start with the definition of health. And when you're listening to these presentations, I really want you to think about, what does health mean in the cross-border region? Is health individual, collective? What is your individual definition of health? Together, how would we define it? Is it the absence of disease? Is it the best quality of life possible despite having disease or disability? Understanding what health is to each and every one of us is a really tough question. They have different meanings for different people. They have different meanings today, prior to and after COVID, and across the globe. These questions are the ones that really resonate and really need to be answered.
So today we hope that you'll also look at health through a whole person health model. So it's helpful to think of health within this context, especially as we've heard from each of our speakers in the introduction, how health and this trans-border region is so fluid. So health is just not physical. but also psychosocial and spiritual. So it helps when you look at this as body, mind, and soul. The social determinants of health provide a better way to understand that health isn't determined by having the best hospitals or physicians or nurses. In the US, there is a focus on the value of a zip code. There is an understanding that health is largely determined by our social environments. Zip code is sometimes more important than genetic code. Looking at this graph, you can better understand how economics, housing, literacy, transportation, and social supports are important, as well as the physical environment and health behaviors an individual chooses. Finally, healthcare is important, but you can see that it is not the focus of this framework in terms of context. It really helps as we talk about the innovative projects within the session to understand these social frameworks. And again, as we hear from the two, one will be based on air, environment, and the impact around COVID. And then secondly, a wellness foundation and how the community was able to rally to, combat some of these socioeconomic factors in light of COVID. So with this framework, we hope again we'll look at health a little bit differently as we move forward. So the next question we have for you, since we've asked you about health individually and collectively, is what is public health? In the United States, the Centers for Disease Control and Prevention have identified these 10 essential functions of public health. There is an assessment piece, a policy piece, and a constant evaluation. At the heart of this model is community partnerships. Mexico has very strong public health frameworks as well. Our nurses have been a part of an international experience and visited UABC and seen firsthand the focus on public health. In our transborder region, public health is evolving and requires quick action to try and stay proactive instead of reactive. Conferences like this are important to keep communication open and share what works and what does not work. Finally, there are 3 levels of public health prevention that we should discuss. The first is prevention. This involves health promotion. It is important to understand that education does not always cause changes in people's behavior. Public health messaging around the importance of nutrition, physical activity, sleep, and coping are important here. One approach we are piloting in Imperial County is assessing the health literacy and then providing educational materials in a format that tailors messages at a level that is understood by our patients. We believe that if we can format and tailor that message at that level, we provide a more patient-centered approach, and that the patient, their families, and providers can communicate better, we would have better outcomes and satisfaction for all. The second level of prevention involves early screening and early diagnosis. Our region has been plagued with multiple chronic conditions like diabetes, asthma, cancer, heart disease, and mental illness. If people know their risk for certain diseases because of what is in their family history or their genetic code and what screenings they need at certain ages, our hope is that they can be diagnosed early and have better outcomes. This definitely was a challenge before COVID and has really been a problem post-COVID. Many people were putting off that normal care, and we definitely are seeing that now in our region. Finally, the final level of public health prevention includes rehabilitation and optimizing quality of life and wellness when there has been a disease or disability. We want everyone to live well and not just have a long life, but have a quality life. Public health challenges in a cross-border region post-COVID have been tremendous, and why we are meeting today. Wasn't it interesting to hear Senator Hueso mention the impact of reducing the border travel times by only 15 minutes and what that would mean economically for our region? We really know the value of this type of conference in our networks and talking about innovation, what works and what we can do to partner as we move forward. The pandemic heightened our disparities. It brought light to economic challenges, educational challenges, shortages of nurses and doctors, food insecurity, border challenges, employee challenges, shortages, and problems for our small businesses, which were collapsing as we move forward, and certainly had an impact on trans-border commerce. Our pre-COVID challenges did not go away. We were in a reactive mode before the pandemic, and we are now trying to come out of survival mode and be proactive to improve the health of our trans-border populations. There is hope. Together, we can overcome these challenges. Today, we celebrate innovation, and we know that together we can move forward. We are thrilled to now introduce our first presentation. We are excited to hear from Belen and Saul about the Border 2020 Imperial Mexicali Air Quality Task Force efforts. Again, we want to have robust conversation. So if you can put in your questions, we will be saving these and answering them both in the chat and then at the end. So with this, I'm going to hand it over to this team, and they'll have 25 minutes to present their innovation. Thank you again for joining us, and we're so excited to be able to have this conversation.
Hi, good morning. I'm Belen Leon. I'm with the Imperial County Air Pollution Control District. I'm also the co-chair for the Imperial County Air Quality Task Force, Imperial Mexicali Air Quality Task Force. Unfortunately, at this time, Saul Guzman, because of the change of government, is no longer with the state of Mexicali. We are working to get a new co-chair from the Mexicali area and hopefully from the state as well. So we'll bring you more updates and maybe another meeting. At this time, if I could share my screen. Can everybody see that? Can everybody see the presentation? Okay, perfect. Thank you. Again, Imperial County Air Quality Task Force efforts for Border 2025. For those of you not familiar with the area, we're here in Imperial County, and then we're the border between Calexico and Mexicali. The pictures below this is the difference between 1.5 million plus in population in the Mexicali side versus 186,000 in population in the Imperial County side. So we have a day vision, a day picture, and a night picture. I really like this picture. It really tells the story. So Imperial County is non-attainment for ozone, PM 2.5, the 24-hour standard, and also the annual PM 25 standard. So what does it mean to be non-attainment? The US EPA uses 6 criteria pollutants as indicators of air quality and have established for each of them a maximum concentration above which adverse effects on human health may occur. These threshold concentrations are called the National Ambient Air Quality Standards. That's what the NAQ means. The 6 criteria pollutants are carbon monoxide, lead, nitrogen oxides, particulate matter, which is PM10 and PM 2.5, ozone, and sulfur dioxide. So again, Imperial County is non-attainment for ozone and PM 2.5 and is now in attainment for PM10. Imperial County monitoring. Let me tell you a little bit more. The levels of criteria pollutants are measured by network of monitors located throughout the state. When an area of the state does not meet the air quality standard for criteria pollutants for a period of time, It may be subject to a formal process where the US EPA designates its non-attainment area. For areas that are designated non-attainment, states need to submit a plan called the State Implementation Plan, or a SIP, which outlines the specific strategies that it will use to in areas back into attainment, which we are back in attainment with PM10. There are also specific deadlines that the state must meet to submit their plans and achieve compliance. One important note to make is that although the 24-hour and annual PM10 standards show linear decline in concentrations, mostly, the Calexico monitor continues to measure above the annual PM2.5 standard. For ozone and PM10, we're in non-attainment but for emissions from Mexico, meaning that a lot of the concentrations are being transported from the Mexico side into the Calexico monitor, and that's where the high elevations are being read. So the monitors, the Imperial County has 5 regulatory monitors. One of them is actually under the jurisdiction of the Air Resources Board, which is the Calexico monitor. We also work with our counterparts in Mexico, in particular in this case, Respira. They have 50 community monitors throughout the city of Mexicali and urban areas. They use Purple Air, so this system is online and we're able to view their data. Also, we work with the Comité Cívico del Valle with their Ivan Imperial monitors. They have 40 plus the Salton Sea monitors, and we also work with them to obtain some of their, not some, but to obtain the community monitoring data. Just as we're speaking, we have the 5 monitors, and here it just gives you the information of the monitors of what we measure. They all have the capacity of measuring ozone, CO, NO2, CO, not for El Centro and Island and Westmoreland, but PM2.5 and PM10. I just wanted to give you a quick rundown of what we measure. So health effects. How does ozone affect my health? If you have asthma, bronchitis, or emphysema, ozone can make your symptoms worse. Ozone can also be linked to coughing and pain when taking a deep breath, lung and throat irritation, wheezing, and trouble breathing during exercise and outdoor activities. Who is at risk? Ozone can affect anyone, but it bothers some people more than others. People likely to experience health effects caused by ozone include people with asthma and lung disease, older adults, people of all ages who exercise or work hard outside, and babies and children, unfortunately. So particle pollution, or we call it particulate matter, or PM10 or PM2.5. So what is particle pollution? It's made of particles, tiny solids of liquids that are in the air. These particles may include dust, dirt, soot, smoke, and liquid, drops of liquid. So how can particle pollution affect my health? Breathing in particle pollution can be harmful to your health. Coarse or bigger particles called PM10 can irritate your eyes, nose, and throat. Dust from roads, farms, dry riverbeds, construction sites, and mines are often types of PM10. So they're bigger particles. Finer particles are called PM2.5. And they're more dangerous because they get into your deep parts of your lungs or even your blood. So the picture I have here is a portion of the PM2.5. If you measure it with a strand of your hair, the thicker part of your hair will be the PM2.5. The finer part will be even smaller than that. So you can imagine how easily this would be going into your lungs. Where does the particle pollution come from? Particle pollution can move from 2 different kinds of sources, primary or secondary. Some of the examples for the primary would be wood stoves, forest fires, and other primary sources. Secondary sources can come from power plants, coal fires, and other examples are factories, cars, and trucks, and construction sites. So we're going to go into community outreach right now for Binational Air Quality Task Force. We are not at, now we're Border 2025, where we started being part of the Air Quality Task Force since it was Border 2028. So we've been about 14 years working with our counterparts, Mexicali, in order to reduce air quality exposure in the airshed. So Border 2025 is an ongoing EPA grant. It focuses a lot of an education media campaigns at this time called Ambientalízate. It's a high-frequency radio and television transmissions. It targets the burning of tires, trash, fireworks, and wood. We do work with the municipality in Mexicali and also with the state in order to implement not only policies, but them denying permits, like for fireworks. There's been a few years back, the mayor from Mexicali did ban the selling of fireworks, right? It's a really hard tradition that we have in Mexicali. Even us from the US side go to Mexicali because a lot of our family is over there, especially living so close to the border. And it's hard to take that tradition away, right? We grew up with that. So banning fireworks was not taken very well by the people. But now they're understanding a little bit more because of the frequent radio and television transmissions that target these four things: the tires, trash, and fireworks, wood, and how harmful they are to the health. And as mentioned, there was a few years back, and currently they're banning the selling of fireworks, including giving sanctions to people who are doing they see with fireworks and any type of wood burning. Hard part also in Mexicali is that a lot of tires or trash, and even wood, is used for warming themselves. A lot of people don't have, you would say, you know, an air conditioner that could have for them to get warm, and they use this type of wood and tires to keep warm. So we do see a lot of it from Mexicali, and it does transfer over to the Plexico monitor. Our goal is to continue with the media campaign and expand to the US as well, which we have. I'll explain that a little bit later. And we also work with local schools in Mexicali and here in Imperial Valley using the FLAG program. I'll also explain that a little bit later. The other type of community outreach we have in Mexicali is the air quality awareness campaign. It's advertising in high-frequency television and radio stations. Once again, not only the ads mentioning the health effects of, you know, the burning of wood and tires, but also the AQI. How could people get the alerts on their phone, or even get the daily air quality while watching TV? So we have contracts with Univision or Univision, which is a US-based television station, and as well as KYMA, which is another US side. But we also have contracts with Mexicali, excuse me. We also have contracts with Mexicali's, like the biggest television stations, Channel 3 and 14, and Channel 66, which display the air quality index right after the weather. So that's worked really well. And they have it twice a day, in the morning and the afternoon. Another campaign that we have is the AQI marquee. So there's a few marquees around the valley, especially one that runs a really large corridor, and it's near the Imperial Valley Mall. And we display the AQI real time. So whenever there's a change in the AQI, people who are passing by or waiting by the light or even eating at the restaurants are able to see the air quality at that time. We also promote the website, imperialvalleyair.org, in order for them to have it on their phone and be able to know the air quality at any time. And what is our goal? To keep promoting the air quality awareness and to keep improving public health. So I should have put pictures here of what the AQI looks like at the billboard. But in reality, this is how it looks like. I mean, it's just it gives you a snapshot of what the AQI is. And then, like I mentioned, it's a live AQI alert that they receive. So they'll be displaying that. And we also promote this at schools with the FLAG program as well. We work with two NGOs in Mexicali and one NGO here to promote those FLAG programs. So in Mexicali have been going very well until COVID. However, during COVID, we tried to do more of website or type of interactions via website or links that people could just go into the municipality or go into the EPCD website. They can click on it and receive information about how their air quality is, what can they do, how to prevent it. And there's a lot of educational material as well that we have been doing. We were working with the municipality. They provided or they obtained a program called Garage, and it's a very extensive program. It's very interactive. They have a lot of games and questions for kids, and I really like it. You should really just look into it because it's fairly comprehensive. And we will, but right now it's only in Spanish. We would like to do it on the US side as well, translated to an English program. So this is how the flag, or basically how the marquee looks like in our digital billboards. The flag program has worked here in the Valley. However, schools and staff do say that it takes a lot of their time to be checking it every hour per se, and to change the flag up and down. So we've been thinking to enhancing this program, doing digitally. We're trying to work with schools in order to have their, almost all of them have a marquee outside, which display, happy birthdays or, events that are happening at schools, birthdays. And we're trying to help them get them in color if they don't have them in color. And sometimes their system is not compatible with, or, we have to know what technology, not compatible to display the alert. So what we're doing is working with the schools to see if we can get a smaller digital sign that we could put outside their office so they could just display how the air quality is at that day. They have not been deceptive to it. They're open to that idea. But again, it's just at this time, we're just speaking with the schools and just to see how interested they are in this type of a program. And for now, that's my presentation. I'm open to any comments, ideas, and questions.
Thank you so much for that wonderful presentation. So we are keeping the questions, and we'll do those at the end. So thank you to all the participants who are posting those. We have the Q&A opportunity. So if you can put those in the Q&A, that would be great. So thank you again, Belen. This is very timely. And we're going to now transition and hear from Mr. Barros on the Imperial Valley Wellness Foundation, how COVID-19 tore through Imperial Valley's safety net and exposed the need for the Imperial Valley Wellness Foundation. So he'll be presenting, and then we'll be coming back for a Q&A session. So keep the comments and questions coming. Thank you.
Thank you.
Don't forget to unmute Roque.
Okay. Should be fine now. Good morning. I want to thank the Reborder Conference for including the Imperial Valley and the Imperial Valley Wellness Foundation in this session. I also want to thank the speakers you just heard and all of you for your interest in this very important topic. I was born and raised in the Imperial Valley. I played in agricultural fields, I swam in the Salton Sea, and enjoyed the 100+ degree summers. I didn't know anything about health and wellness or its impact on us. But I do remember a small box that Dr. Caldwell would give me that said breathing pills. I didn't know I had asthma. I just knew sometimes I had a hard time breathing. Agriculture, as you know, surrounded us, so it was easy to work in the fields as a teenager. I learned to drive a tractor, plow fields, and to irrigate. I was always amazed by the crop dusters flying by, spraying the fields, and thought what a great job to have. As a kid, I also worked in a print shop and printed many labels for the local chemical company. I remember reading about all of the precautions one should take when using these chemicals, but didn't think twice about standing around, watching the fields get sprayed, and then running back into them to play. I attended Imperial Valley College and San Diego State's Imperial Valley campus. I moved away as a young adult to finish school and to pursue my career. But I always knew that I would return to the Imperial Valley, and I'm glad that dream has become a reality. I see the valley differently now. It has a population of 180,000. 25% of the people live in poverty. Our unemployment is high, and we experience severe health issues. Unfortunately, I am 1 out of 5 children that got asthma. At one point, it was severe that I started using an inhaler, and I remember my parents staying up most of the night with me when I had problems breathing. Diabetes was also present in my family. My mother suffered from this disease for a very long time. I remember her being on a specific diet and injecting herself daily with insulin. At the age of 73, she passed away from diabetes. I will show a video at the end of my comments on the environmental issues affecting health in the Imperial Valley. Our largest healthcare providers in the Imperial Valley are Pioneers Memorial Hospital and El Centro Regional Medical Center. The largest network of community-based clinics is Clínicas de Salud del Pueblo, with 10 clinics, and it is a federally qualified health center. The Imperial Valley has a significant shortage of specialty care providers. For example, we only have 1 diabetes doctor and 1 diabetes educator. Over the last 5 years, we have seen an increase in specialty care services in the Imperial Valley with the addition of neuroradiology and a cardiology center. The nonprofits in the Imperial Valley play a critical role in healthcare. They provide services and programs that address food insecurity and health and wellness. They provide education, prevention programs, and support health promotoras. As a rural and impoverished region, COVID devastated the Imperial Valley. We had the highest infection rate in California. The Imperial County had 37,000 cases of COVID, and close to 800 people died from it. Our local hospitals were overwhelmed by COVID, and over 500 people had to be transferred to San Diego, Riverside, Los Angeles, and San Francisco for care. Mexicali hospitals were also overwhelmed, and US citizens and green card holders were crossing the border to get medical attention in the Imperial County. Esperanza Colio, Deputy County Executive Officer for Imperial County, shared that a binational plan was created with Mexicali, which included over 1 million masks being donated and a communications campaign to create awareness and identify strategies to slow the pandemic. The Imperial Valley Wellness Foundation, in partnership with the Alliance Healthcare Foundation, raised more than $850,000 to support community-based organizations addressing the impact of COVID. In total, we funded 17 organizations, and they were able to serve 84,000 people per month during this time, many of which were farm workers and children. COVID required us to respond in a different way. We didn't hear why we can't, we heard what can we do. There was a new balance that was heavily weighted in favor for the most vulnerable. The vulnerabilities and disparities were more visible, and we responded to the needs. This new balance that was experienced with COVID needs to continue in order to address the needs, challenges, and inequities faced in Imperial Valley. We are now talking about going from response to resiliency. What would resiliency look like? Education for all, employment for all, health services for all, housing for all, and equity for all. And what will it take? This new balance needs to start with the voices that have been silent or not included. Those that we say are going to benefit need to be involved from the beginning in determining how to improve and make things better for them and their families. We can't go back to the way things were before COVID. We need to continue to make the Imperial Valley a better place for all. We have many assets to build upon. Our ag industry, it generates $2 billion in revenues annually. Our renewable energy industry, we are one of the largest geothermal producing counties in the United States. The lithium industry, it is estimated that 40% of this worldwide resource will be coming from the Imperial Valley. We need to develop strong partnerships with all levels of government, philanthropy, and impact investors. We saw this happen with COVID, and we need this to continue. The pandemic response needs to become a permanent response. The Aspen Institute, the National Rural Advisory Committee Thrive, and others have been working together to answer the following question. What needs to happen to advance rural, community, and economic development in a way that improves equity, health, and prosperity for future generations? Part of the answer is rural development hubs. They are playing an important role throughout the United States to advance rural, community, and economic development. The Imperial Valley Wellness Foundation is taking on the role of a rural development hub. We are currently working with communities that lack visibility and a voice at the decision-making tables. We are creating a locally governed foundation that attracts resources and provides funding in perpetuity for the Imperial Valley. We appreciate Alliance Healthcare Foundation's generous matching grant of $7.5 million to move our efforts forward. I feel very fortunate that I had the opportunity to return to my rural roots. I have worked across the country and have seen how powerful it is to have a local foundation that can provide the needed resources in perpetuity. I had a dream that someday I would be part of a foundation that would be providing those types of resources where I grew up as a child. We need your support in building the $25 million endowment, and I invite you to be part of this exciting journey with the people of the Imperial Valley. As I mentioned earlier, that as a rural development hub, our work at the Wellness Foundation includes supporting communities to increase their voice and visibility. I will end my presentation and comments by providing that opportunity to a few young people that live along the Salton Sea in the Imperial Valley with this video. Hopefully I can get the video on.
Mr. Bob.
There is a place that I am from, the Salton Sea under the California sun. It's called a sea, it's called a lake, but either way, it was made by mistake. A place once full of fun, relaxation, and rest. Why are we left with a sea full of death? The lake keeps drying, and the shoreline is thin. I feel like I'm dying when its dust hits the wind. I cry for help. Am I alone? I can't breathe. Please, fix my home.
Thank you very much for the opportunity to share with you and for this video from the Salton Sea. That concludes my comment.
Okay, I think it's time for us, then to open up, the panelists to various questions that people have. And I've been grabbing some questions from the chat and also in the Q&A post. And the first question, this goes to Belen, and I'll try to alternate them. This is from Eric Frost, and his questions come at the complex variables that affect air quality in the region. And his comment is, wind almost always blows to the south in Calexico, Mexicali region. So out of sight, out of mind seems like is something that is part of the US, including air pollution from cities like Los Angeles, Riverside, and other cities. Wondering how much real-time monitoring is being communicated to the communities on the border. How can we, and then an additional question to Belen is, how can we resolve this damage that's caused by other people in this border region?
It is true. We do get some transport from the Los Angeles area at points, but it's not as much as we do from the Mexico side, from Mexicali, right? We are in discussions to see how we could better for air quality on both sides of the border. We're constantly looking for new projects. We're constantly discussing it with the state and local level government. It's been a challenge, just being honest here, it's been a challenge every time Mexico changes the government to continue some of the projects that we already have in place. So at times we feel that we have to start again with the new government, and depending on their values of environmentalists, right? Some of them are pro, some of them are con, and some of them are willing to help us with this issue. So to resolve this, we have to have some type of agreement between the two countries that would have, I don't know, I'm talking about maybe something that would have in place already policies and regulations, or even just an agreement between the two countries that we could continue every time the government has changes over in Mexico. Since the time I've been here in Imperial Valley, I think I've gone through maybe 4 or 5 governments already, and it's the same thing every year. Only 1 year when we had the help from the mayor of Mexicali was because he had been already at the state level, and then he changed over to the municipality level, so he continued those projects, but it was after 6 years. So one of the things we do really have to do is some type of commitment between the two countries in order to continue the projects that we have now, or future projects that could help even the development of new projects. I don't know if that answers the question.
Okay, I'm going to switch over to a question over to Roque. This is also from Eric, and I'll be alternating back and forth. Imperial Valley, as you described, has huge insight into real solutions that could be shared with places like the RLC of Uzbekistan and Kazakhstan, who have incredible challenges that the Valley has solved. Might we be the teaching center for the world with similar closed basins, agriculture, pesticides, asthma, and a host of other challenges?
Yeah, thank you for the question. I think that there's a lot that we have to share, a lot that we can share and a lot that we can learn as well. And so I think that, we recently hosted the Imperial Valley Wellness Foundation, a webinar, and I think that in working with other partners in the Imperial Valley, that we should probably do more of those webinars, especially around some of these topics that we're just talking about, because, the great opportunity now is that, we don't all have to go to one place and travel to have these conversations. We can do it just like we're doing today and have people from all over the world participating. But definitely look forward to hosting and invite any of you that are on these calls, to reach out to us and to think about opportunities that we might have around sharing and learning together.
We're going to go back to Belen for this question. Like much of the planet, did the shared Imperial and Mexicali valleys see a significant dip in pollution following the early months of the pandemic? And then also to further along that, so that's one question. Another question, is there a month of time where the downward trend, if there was one, headed back up? Like during the pandemic, did you see that downturn? And then at what time did we see it start going back up?
I don't have all that data with me right now, but it's very interesting because it's something that we did want to measure. Obviously, all of us were not prepared for the pandemic to hit the way that it did. And I will research that a little bit more to have a better answer for you and maybe come back with more data. But the trend itself of mobile sources, we did see that coming down. And that was the reason, because the border was restricted to some certain hours, right? So we didn't have those long lines anymore. The other things, a lot of people were home. They were not traveling as much or doing any outdoor activity as much as they were before. So we see health-wise, did a trend of asthma going down in hospitality. But again, a lot of people were afraid to go to the hospital for an asthma attack because they were afraid to get sick from COVID. But again, I don't have that straight data, but I could definitely come back and share that with you. Okay,
and that question was from Richard Brown. And then Belen, we have another question for you from Penelope Quintana. Hi, how do you think the California and Baja California regions can best work together to tackle the cross-border air pollution from agriculture burning?
That's a great question as well. We're currently actually in discussions with Mexicali. They, back in believe in 2009, the government that was in place that time, we had several meetings with them, and they adopted a policy. I don't want to say a regulation, but it's a policy which is very similar to our smoke management plan that we do have here in the valley. If you compare it side by side, it's very similar. The only thing is that here in Imperial County, it's controlled by the Air Pollution Control District. It's one entity. While in Mexico, it's 3 or 4 different entities that want to do the same thing. And I believe there's a lack of communication somehow. Again, the government that is in place at this time wants to retouch that subject and make it better. So we're currently in discussions with the state and local municipality in order to improve their ag burning program that they have at this time. So right now at this time, I just say a lot of communication is in place, and hopefully before this government is over, we are able to establish some type of policy or regulation at this time, even federally, that could tackle ag burning in Mexicali.
Thank you. Roque, this is a question for you from Carl Nettleton. How can organizations that want to be part of the rural hub you are developing get in touch with you and the Imperial Valley Wellness Foundation? And how does the rural hub work?
Oh, great. Thank you for that question. So over the last, about the last 6 years, I have been actually supporting, I was previously to being with the Imperial Valley Wellness Foundation, I was with the Ford Family Foundation. And part of my work there in portfolio was supporting rural development hubs in rural Oregon and Northern California, the Siskiyou County. And we found again through that work, and I mentioned earlier too, that I'm part of the National Rural Advisory Committee named Thrive with the Aspen Institute around, how to best support rural communities. And so what we found as one of the best practices so far has been around these rural development hubs that serve as intermediaries and work with these rural communities in developing comprehensive long-term visions with multi-sectors coming together. So in one instance, for instance, in the Sayusla area, which is one of the hubs that I was recently working in, we brought, it was about 5 or 6 communities together, and they identified their needs, but more importantly, collectively, they created a long-term comprehensive vision for their region. Working together that way, they were able to share resources, but more importantly, I think bring other resources from the community. We did a study there in 2019 that demonstrated that collectively, our investment as the Ford Family Foundation was about $100,000 for their infrastructure and operations, but collectively they were able to bring in 2019 about 12 to $15 million of outside resources and funding. And so that's really the power of these rural development hubs, bringing together community hubs. And so right now we're really looking at some of the smaller communities in the Imperial Valley, working with them. One of them is the North End Alliance that brings together Calipat Island and Bombay Beach, working together to develop. One is, I think, more importantly, to give them more voice and visibility. And so that's really the work of a regional development hub. And for those that are, interested in that work, please, I think the question was how to get a hold of me, and I can put it in the chat, but, always call me, and we have my email as well, and I'll put that in the chat. So thank you for the question.
Oh, and then there's a follow-up question from Carl is, with your experience in the community, in community development, can you speak to any specific examples from the past, like within the Imperial Valley that you've been involved with?
Well, as I mentioned earlier, right now, and I just, in June, I started my role here in the Imperial Valley, right? And so, I've had a short period of time here, but just in that short period of time, one of my, I believe in a community building approach that starts with, listen to learn and go to, some of the values and practices, or go to where the people are, and start with what they know and build on what they have. Those are really critical for me. And so I've been doing a lot of that in the Imperial Valley. And as I mentioned, because of that work, then working together with the North End Alliance group, which includes these 3 communities, and have been reaching out and looking at other communities like, Westmoreland and Winter Haven and Sealy and so forth, some of those smaller communities, and working and hopefully exploring opportunities to work with them, with more voice and visibility. So those are some of the examples of the work there, but also, working closely with Bobby Brock with the Imperial Valley Community Foundation, met also with Elena Hoyt, who's on here as well, about how can we partner in the Imperial Valley to move some of these efforts forward. And so still a lot of work to be done, but really excited about the folks that are on this webinar today as we continue, to move the Imperial Valley forward.
Okay, and the next few questions are going to go back to Belen. Leonardo Alcaraz has a question. When does AQI change?
Could you repeat that again?
Yes, when does, he says, AQI change?
When does it change? There's certain events that happen that make it change. You would say that wind events would make it change. Any type of activity near a regulatory monitor, even construction. We've had it change when even maybe an ATV is doing wheelies around a monitor system. But those trends change, right? So something like that happens, it increases and then it decreases. So we know it's some type of temporary activity that's going on versus a wind event, you would say, or a natural event that is going on. But if you're signed up to receive AQI alert, it would change maybe every hour. It may be that for 3-4 hours, it would remain, you would want to say, in green, which is good air quality. But if there's some type of activity going on, it may change within the hour. But you would see a trend of peaking and then going down. So we can't say exactly when it would peak or change. It's just depending on the weather itself and what's going on at that time. That's regulatory monitors, not the community monitors.
And switching gears, Katie Bailey has a question. Have there been any efforts or discussions about formally evaluating the impact of these community campaigns on air quality?
We have. We keep a trend. If we do, if I'm answering the question correctly, meaning the community campaigns, every year we have to do an annual report, which we have to report if we've received how many increases in signups that we have for the AQI alert system, right? So we keep track of that. We also keep track of the trends. So in Mexicali per se, how many views Channel 66 has had, or it just depends. We keep communication with our local stations in order to see what trends we see there. We also have Facebook and or YouTube that we keep the numbers as well there. So that's how we keep kind of a number or data of how our campaigns are working. If they're not working, then we try to change or have those funds going to another type of campaign.
And Moses Perem has several questions for you, Belen, and then he also has one for, for Roque. First question is, are the new solar projects affecting or adding to bad air quality in the Imperial Valley?
We have not seen any negative effects from the solar projects. We discussed about how the solar projects did take agricultural activity away, which would cause a lot of dust events, you would say, at times. But yet, solar power, we have not seen any trends or for bad air quality.
So his other question was like, what can be done to minimize the air quality effects and still have a solar farms?
It's interesting to say, it's interesting to know where he's coming from that question. Maybe he knows something that we're not aware of. I would like to actually speak to him privately and just, say what have you seen or heard or read where these solar turbines or solar powers have actually generated some negative air quality. And maybe we have further discussion regarding that.
Okay.
If that's okay.
Yeah. And I'll see if he makes any more comments, and we can follow up with that question. But then he also has a questions for Roque. The thermal energy production, is it adding to the economy of the rural community? And on the other side, how if the lithium production industry contributing to better the health effects in the Imperial Valley area?
Well, I mean, that's a good question. I mean, I definitely think it's adding to thermal energy is adding to the economy of the Imperial Valley. I mean, there's, I know lots of folks that friends of mine or that I'm related to that actually work there and are employed there. There's still lithium is new. It's just being explored. It's part of the geothermal process, right? The brine from that, includes the lithium in it. And so I think there's still quite a bit more to learn from that. I just was recently on a tour with some of the folks out there that are doing the geothermal and the plants and talking a little bit more, trying to learn more. And I think one of the things that we want to do then is, as I talked earlier about, how can we have more learning opportunities, sharing and learning opportunities. I think one of the things that we'll be looking at, hopefully partnering with others, is a webinar around that where we bring some of the folks, the geothermal and the lithium folks, and have these types of conversations to learn a lot more. There is a report that I would recommend, I don't have it in front of me, but I would recommend the Imperial Valley Economic Development Corporation. Some of you may know Tim that's there. And Tim actually has put together a report that includes geothermal and some of the additional information around lithium, but more around the economic development in the Imperial Valley. And I would suggest that that you look at that because it'll provide a lot more information than I can. And I think Elena just put that up there, so in the chat.
Yeah. Okay. And Belén, follow up to Moses Perem's question. I mean, only at the start of the solar farm prep, with the grading and the air quality issue associated with that, not the solar power production itself.
Okay, yeah, there all projects here, our new construction projects that are going to create air pollution activity do have to provide a dust control plan or to the air pollution control district, and we check them. We go review and enforce any rules and regulations that we do have during construction. So like any type of construction, as long as they're watering the area and keeping the 20% capacity or lower, they're going to be in compliance. Should there be anything or a complaint nearby residents, or then we would go investigate. But by the most part, with the dust control plan, any construction site, including solar, knew what to abide by.
And I hope I get this question right, and this is kind of open to all of our panelists. Does the U.S.-Mexico Bicentennial Framework for Security, Public Health, and Safe Communities that the Secretary of State Blinken and Mexican Foreign Minister met to inaugurate with Presidents Biden and the AMLO supporting, that's due in January, how might this special group help to define what the new agreement should be?
Interesting question. As I mentioned before, the US and Mexico do need an agreement for continuality. So I'm hoping, I don't know what their agenda will look like, but I'm hoping they come into a consensus of what type of agreement they would need to have between the two countries for projects, for grants, for anything that could help the US help the Mexico side and Mexico side help the US, because they could help each other mutually. And especially during air quality, there's a lot of things that we could do together in order to decrease air quality. but there's not that continuality between governments. And that's something we truly, truly need because I've seen it year after year. That would be my response for now.
And then this is another, I mean, Roque, do you have any comments on that question?
Sure. Yeah. The only thing I would say is, like with community building, I hope that there's a strong community building approach component to that. Always in community building, we always talk about, the phases of listen, then design, and then implement. And so I hope that there are some, a strong listening phase that happens, on both sides of the border that engages, residents and multiple stakeholders in the different sectors, prior to the actual design of what that may be, and of course the implementation.
Okay. And here's another question from Eric Frost. One of the most remarkable aspects of the Salton Sea is that the closed basin is an incredible reservoir of climate change through huge numbers of years. Salton Sea has dried up and filled over and over, even in historic time. So using the Salton Sea as the profound record of climate change could equate to huge contribution globally. And this is kind of a generic question. So how much is SDSU and other universities using this incredible data of the Salton Sea and the Laguna Salada for global climate change solutions and records? Does anybody have an answer to that?
Well, my only response to that is to get together with SDSU and have some communication regarding that, right? In order, maybe there's another project there that we could work together with our universities. And that's very needed. A lot of education and awareness is needed around that area and around, the Imperial Valley, including Mexicali, because a lot of that water, does transfer over to the Salton Sea from the Rio Colorado. So hopefully we get into conversation with SDSU and any other university that is doing this type of reporting and data collection.
Yeah, and I would also add too that there is on a monthly basis, there is a call, a webinar that's hosted by, I think there's 3 state agencies. The Wildlife Refuge is one of them, I believe, and there's like 3 state agencies that are part of that, and there's like a community engagement component to it as well, where they're focused just on the Salton Sea and looking at, solutions, and so there's a lot of folks that are gathered around it. So I think and I'm sure I know that some of the universities are part of that as well. So I think that's a great place to engage with as we think about the Salton Sea and other opportunities around it.
I have a question for both of you. So part of our purpose with the SDSU Imperial Valley Rise Center has been to be that research hub. So it's been great to hear about the Wellness Foundation being that kind of development hub. And this is where we've really noted that we need a bottom-up approach here in our region, right? Things need to be from community and help inform then, partner academics, and then be able to share our message with our government so that we can have that policy that you both have talked about change. So a question has come up in light of the use of this video in social media. So have you seen, what are the best methods you've noted for both of your initiatives in terms of getting the message out there, whether it be to our community members or, as we've heard from Eric and a couple, beyond? Like, is it social media? Has it been through the use of videos, storytelling, publications? I guess, how do we best inform others so that we can change policy? And then how can we be positioned better to bring in the funding to be able to continue this work?
Go ahead. Go ahead, Rob. I definitely think that these levels are really critical, right? I mean, we start at the local level, then the state level, regional, and federal. And so I think, and how we go about that. I mean, I think that it's really important that, first of all, at the local level, that we're there in person with folks on the ground, connecting with them in ways that feel the most comfortable to them, right? Because, sometimes we say, well, come to us, but it's really about us going to them and making sure that they're comfortable. But at the same time, there's different levels of voice and visibility, even within our county, right? I mean, there are, organizations and institutions and sectors that already operate, at state levels and federal and national levels. And so the key there is for all of us to demonstrate a united front, right? To come together. So I think, we talk about, building relationships, we talk about building networks, and I think it's really critical that we build strong networks, right? So that then we can communicate the same message, to whether it's, outside of these areas, whether at the state level or the federal level. And so I think this conversation today is a really great opportunity for us to identify, who of us can come together to start, crafting that message and then sharing that message, outside of the Imperial County.
Just to add to that, our Ambientalízate campaign, I think that's one of the key factors we have been doing, getting together with the municipality and state and having the same message for both sides of the border, like a no burn mentality type of message. And they're well aware that that's the big issue here in the Imperial Valley as well as Mexicali, right? So joining forces in that sense with this media campaign, I think it has worked for years. And I guess doing it every year, because we do this campaign from November to January of the year, where we see the most peaks in the Calexico station mostly, it's worked. And I do agree with Roque that united front we need to do, because a lot of us have the same message, but we communicate it in different ways. So might as well come together with the one same message and just make it a bigger campaign.
A follow-up to that, with both of your work, have the residents been willing then to share their story? Because that seemed powerful, where we had somebody sharing that their asthma struggle, or so anyhow, how has that been as you've tried to pitch this and show, I guess, the human factor? What are the strategies that have worked about getting the local people to trust the media or you guys to support that story?
Well, I'm very fortunate that I grew up here in the Imperial Valley, and I went away a little bit for my career and schooling, but now being back, it's great that my family and other friends, I've stayed connected the whole time. And so when I come back to these communities, I usually know everybody in these communities. And if not, so far I found out that there's only 1 degree of separation from these folks. And so that's really helpful, because you don't have to spend a lot of the time. The trust is already there because they know you. And I say that because coming back from Oregon, I didn't grow up in Oregon. I'm not from Oregon, but I worked there doing community work and engagement work, for 6 years. But I had to took a lot of time to develop those strong relationships. And the good thing here is that many of us that are here on this call from the Imperial Valley, we grew up here, so we have those relationships. And I think that's has been really critical. But also is that, in these communities, as I've gone around and talked to these folks, is in some instances they say, well, nobody's come to visit us, nobody's asked me, and so when the video that I showed, for instance, of this gentleman and a woman that produced it in Nyland, when they shared it with me, I said, wow, can I take it and share it? And they go, of course, yes, we'd love you to share it. So I think it's a matter of just going and meeting with these folks and having conversations and then sharing. I think, part of my work is as a rural development hub, as an intermediary, is how to help these areas gain more voice and visibility.
And I would say the other part of it over here is because government, I work in government. So it's very hard to get the trust of the community when somebody works in government, right? However, just as Roque, I am from the community. I understand the community. And under our AB 617 program that we have here, it's been very successful. We've been getting a lot of good ideas, good backfeed information from our community. We have 30 members, 2 being co-chairs in our AB 617 program. And it's a program that I think should go to Mexico as well. Something similar to it. We do have the air quality task force, but it's not as a community based, I would say. I would like it to be. more than like an AB 617 type of community program in Mexicali. But I think more and more with the new programs, the approaches we have of advertising, the approaches we have with community awareness and education, the community has been opening up a little bit more. We have been receiving some of their ideas, and we're being taken into consideration as well. We're not just writing them down and just keep them in a file. No, we're trying to do something with those ideas and communicating with the community a little more than we used to, right?
So Carl just added a question, Carl Nettleton, in the chat. So how does the Imperial Valley as a region gain more visibility in government and philanthropy where the help for this community is likely to come from?
Well, Belen can probably speak more around government, but I'll talk a little bit more, some around philanthropy. One of the things that we're working at the Imperial Valley Wellness Foundation is developing a rural funders network. And so I've been working a little bit, I know I've had a conversation with Elena, and then I've also met with Bobby Brock from the Imperial Valley Community Foundation and Megan Thomas from the name of the Catalyst of the Imperial County and San Diego County. And so collectively, we're looking at exploring opportunities. How do we develop this rural funders network? And we've talked to other funders as well in bringing more resources and vision and visibility and voice to the Imperial County. So I hope that that's one way. And I think, as Belen and I mentioned earlier, I think a united voice, and a united message and a united vision is what is a way to get more, I think, outside government support as well. And there's some opportunities coming along soon with the it's called SURF, and it's the funding that was just recently released. And I think there's going to be some funding there for there's 13 regions that were just developed, and a few of us from the Imperial County attended a conference in Monterey last week where they were talking about this $600 million that is going to be provided to 13 different regions throughout California. That's sort of the way that the money is being divided. And so, the southern border region is San Diego County and Imperial County coming together. So I think there's a great opportunity there, I think, for government support and for us to unite, here locally and with San Diego for this funding that'll be coming soon.
Yeah, under the government side, all of the programs we do, all the grant programs that we have, they're actually for the community and they're with no cost. So we have like the flag program, we provide the flags and the information, the training to the schools at no cost whatsoever. They do not bring any cost. Air filtration systems at school at this time that we're doing at the 32 schools in the corridor right now, which is Central, Heber, and Calexico. It's these systems go from $120,000 to $180,000 at no cost to the schools, and it's a program for about 5 years that they will be receiving air filtration systems. Electric buses or paving of parking lots at schools or local city, local parks. That's all free. I mean, it's through a request for proposal, right? But it's free to anybody who applies. So I think we're doing our due diligence. We could always do more. And we're welcome for any suggestions for other type of projects as well. But there's many projects here in the county that we do at, that are for the community only.
Belen, you had mentioned about some of the challenges with the change in leadership in Mexico, and we get communication set, and then all of a sudden there's, that's broken. So we had heard from the Ventanilla de Salud in the beginning, the welcoming session, and I was just curious, have you worked with them, or is there another body that you found that is consistently in force regardless of that leadership change?
No, I have not had the opportunity to speak to Ventanilla, you said? No, I have not had the opportunity, and hopefully we will get into communication and have a discussion regarding that to see how this could change, because it does need a change. speaking with maybe local NGOs that have, I want to say, a lot of contacts in government, that not all of them change, that have been helpful. However, mentality-wise and what their agenda looks like every 3 to 6 years is very different. So we don't know really what we're going to get, right? So it's just, again, having that contact, gaining that momentum again for that government to actually hear us out and have a first discussion with them and tell them the good work that we have done for these past years. And I think that's the only way, or at this time, that has worked with us, just having knowing who's coming in, and some of the people that do keep their position, having the contact with them, and maybe that's the only way that we have or to speak to the new government. So that's something we really have to change. There has to be some type of, again, continuality with this. We just can't be trying to see what's going to happen in the next 3 to 6 years every time, right? We just want to continue doing these projects and these good works and just not disappear until we get somebody that's able to help us.
Rocky, I was thinking about when you're building this rural funding hub, and we're talking about the development piece. What is it that, everybody who's on the call maybe has a particular area of interest? So we've heard about, air quality and asthma and like the Salton Sea. So what is a way that people could provide with their information? Is it like a one-page like concept, white paper? What's helpful as you go and talk to different funders to be able to showcase the opportunities here that people might want to invest in?
Yeah, well, I'm like I said, I'd really like to go to where the people are, or the organizations or institutions are. So I, ask any of you that are interested, to please reach out to me. I put my number on there and email. I'd like to meet with you, learn more about, the issues, the needs, the opportunities that exist, so that collectively, we can come together and share that message. And in this work, again, I've done a lot of this work throughout the country, and it's really been that all of the sectors come together, and we talk about, what's a healthy and vibrant community look like for us, right? And we start with that question because it provides input for an opportunity for everybody to give input, right? Whether you're talking about infrastructure, transportation, health, education, you name it, recreation. It gives an opportunity for everybody to chime in. And in this, and what we've done then is created these long-term comprehensive plans where multi-sectors came together, right? And they've decided, this is the vision for our region or for our community. And these are the 7 important components. Usually they're broken down into 3 main ones. We call them the 3 Ps: people, place, and prosperity. And so if the plan and the vision includes components of people, place, and prosperity, that's usually opens the door and the opportunity for everyone in the community or in the region, or whatever the case may be, to be involved and to have an opportunity in this. And so, as a rural development hub and as an intermediary, I look forward for that opportunity, to bring forward more voice and visibility, no matter what group, community, or institution it may be.
We have one more question that just popped up in the question and answer, and it's from Moses again. And he asked, during COVID, COVID combined with drought and Santa Ana winds, PSPS events of power shutoff, did the utility industry provide any help or support to elderly or people with underlying conditions, providing them with generators, battery support, community shelters, and any such help to minimize such hardships? I don't know if you guys can answer that question. This one just popped up.
I would not be able to answer that question to see if it directly or local company helped, with those. I know there was other agencies that did help with that type of, that offered that help, but I'm not sure if our local, you would say IID helped with that type of effort.
Yeah, I couldn't answer that question either. What I could say is that, we were able the Imperial Valley Wellness Foundation, along with the Alliance Healthcare Foundation, were able to raise $850,000 that went to numerous organizations in the Imperial Valley that were able to support some of those needs that Moses just asked about.
Thank you very much. This has been wonderful dialogue. We have about 5 minutes before we transition out of session 1A. So I'm supposed to just revisit the themes that we've been hearing. Again, you can use the chat or the Q&A as we wind down the session. But in the very beginning, it was exciting to hear about there are champions on both sides of the border, a lot of innovation that's going on, and there's been a lot of coordinating and infrastructure building. So this is exciting, as we heard about, Belinda talking even about AB 617 and monitoring and that messaging and how it had increased the community awareness and participation, and all that the Imperial Valley Wellness Foundation has done to coordinate, organize, provide that vision and voice. So it appears that we have heard consistent communication from all parties is critical, that there needs to be multi-sector representation. And I think that's been evident. It's been interesting as we've heard from a government perspective, and then certainly from the foundation perspective. We keep hearing that it is important that we provide that voice to our community, and that it did appear that that had to come from within, that authentic, being able to go out and speak to these individuals was critical. We next heard about the importance of community, academic, government partnerships, that there's a role of all the universities that they can play in hopefully fostering some of the research, and then being able to partner as we see opportunities to then be able to share beyond our region. I liked the way you both presented on being able to share locally, and it was interesting how Belen even talked about starting in this kind of hub, looking at El Centro and Heber and Calexico, and then Rocky talked about being able to go beyond and having the smaller communities. So interesting how we have a rural border context that is invaluable. It was great hearing from the participants about the other regions across the globe that had similar dynamics to us. I don't think I always think about that. I often think, well, we're kind of unique here, but that was really eye-opening. So thank you, Eric, for pointing that out. We also heard the value and saw the value of storytelling and the use of the videos. We heard the value of social media and communication campaigns, in particular around COVID and now as we move beyond. And then we also heard about the importance of being able to be proactive. And so thank you. Jessica had provided in the chat the link from the EPA about that Border 2025 program and how we can be ready and know exactly how to change policy and then to bring down funding. So wanted to thank Carl for talking about that quite a bit and being able to regionally be proactive. We heard about this opportunity to have this rural funders network, and that there are some big opportunities coming. So thank you for posting about SURF. And again, knowing that it's helpful when we had that context from the beginning. And that's where Mike and I wanted us all to think about what it mean to have health individually, collectively. And so that was great that we heard, we really want to have healthy, vibrant communities that can come together. And then we loved how you wrapped that up nicely about people, place, and prosperity, and that can open the doors in our region. So I don't see any other Q&A or chat, but we definitely wish to thank our panelists for wonderful presentations. And as you all go throughout this 2-day conference, again, we hope that you'll walk away with that hope. There's some really neat work, and then the connection piece is critical. So we've all shared our contact information, and we hope you'll reach out to us. And we hope as you transition to the next one, The session at 12 o'clock, career readiness in the public health and mental health fields. That you are thrilled that you joined us for this conference. And as we look to tomorrow as well, you'll rejoin and that we can connect and communicate and move forward. So thank you again for taking the time to spend with us. And we hope you have a great rest of your day. Bye.
And remember to provide feedback via the exit surveys that will be given to you at the end of the day for each of the sessions that you participate in.
Perfect. Thank you.
Thank you.